All left-sided murmurs will increase in intensity with increasing preload. Why? Increasing flow through a valve should increase turbulence and cause increased murmur. But there's always exceptions to the rule. Mitral valve prolapse in HOCM. The ventricles are so thick, the valves are all collapsed. Lesser volume of blood in the left ventricle equals more murmur. What about afterload maneuvers? How do you increase afterload? Is by hand grip. Whereas how do you decrease afterload? You give a medicine. Mitral stenosis and aortic stenosis are both forward flow murmurs. Mitral regurgitation and aortic regurgitation, backward flow murmur. So when you have a backward flow murmur, your afterload acts as the pump. So when you think about a forward flow murmur, when your afterload drops, it is easier flow, because if you decrease your afterload and your flow is forwards, by dropping that pressure, it increases your pressure gradient and blood flows from a high pressure to low pressure. So increased murmur. Whereas when it comes to a backward flow murmur, it all depends on your afterload. If your afterload is increased, it's going to push blood back and cause increased intensity of murmur.